The menstrual cycle of fertile women usually lasts about a month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows to about the size of a grape. At a point midway in the cycle, this egg is released from the ovary and ovulation occurs. Ovulation is also regulated by hormones. The egg, which from this moment on is ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation is a naturally occurring event, and the desire to have children is a similarly natural instinct. But that instinct cannot always be fulfilled. The causes of unwanted childlessness are numerous, but so are the means of treating them.
IVF is in vitro fertilization, and it's a process whereby the eggs and the ovum are gathered or harvested from the woman, and the sperm is gathered from the father. And the two are reunited into, well, not reunited, but united in a petri dish. So it becomes a clinical procedure, and hopefully with fertilization, that's the beginning of a pregnancy.
The technique of in vitro fertilization, or IVF, removes several eggs from the ovary for fertilization in the laboratory. After a few days, one or two of these fertilized eggs, which are now known as embryos, are returned to the uterus in the hope that they implant and become a pregnancy. Women having IVF are given special reproductive hormones to encourage several eggs to develop in the ovaries. Final maturation of the egg itself is induced by the administration of a further hormone. 36 hours later, fluid containing the eggs is drawn from the ovary with a needle. This is usually performed under light sedation in a short outpatient procedure, with the doctor using ultrasound to check proceedings. The eggs collected from the ovary are then mixed with a sample of the male partner's sperm, which has already been washed and concentrated. The eggs and sperm are left in an incubator set at 37 degrees for 24 hours so that fertilization can take place. During this time, only one of the many sperm cells will penetrate the outer layer of the egg and achieve fertilization. Following fertilization, the cells divide and multiply and form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin, flexible tube, where it is left to implant and form a pregnancy.
IVF, most positively, is a good option for mothers and fathers who've been trying unsuccessfully for a baby for quite some time. My advice to couples considering IVF would be to research their options thoroughly, the success rates of the various hospitals and doctors who are offering IVF, very definitely.
Herzliya Medical Center is nested on the beachfront of Herzliya Pituach and is the leading private hospital of Israel. Thousands of international patients are coming each year to be treated with our different treatments, including IVF. Our success rates are very high and are at par with the best IVF units in the world. And that's thanks to a very, very dedicated lab team that is working day and night to make sure that this sensitive process is taken in the best professional hands. Our process is totally ambulatory, so the couples are living in their own home and environment. And we try to reduce the time in the hospital to the minimal time that is required. Our teams are highly efficient and educated to take care of each one of them separately and to make sure that it adds to the success of the story. We have also support groups that are working with us for the couples who really want and need it.
Infertility is defined as a medical problem in which a couple tries to get pregnant for more than a year without a success. When they come to our medical center, to our IVF unit, we can provide them with intrauterine inseminations, IUI. We can provide them with the routine, regular IVF that was born in the United Kingdom in the year 1978 by Edwards and Steptoe. We can provide them with ICSI. ICSI means the technique, the micromanipulation, the technique in which we know how to insert a single sperm into the oocyte, into the egg, and to fertilize her in such a way in cases in which the problem is male infertility, lack of sperm, or very little number of sperm. We are offering our patients embryo freezing for future treatment. We know how to freeze eggs, unfertilized eggs, for future treatment. We are assisting women with surrogacy, and we deal also with egg donation. And something which is not infertility, but is based on the infertility techniques that we are mastering. This is the technique of PGD, the pre-implantation genetic diagnosis, that we are at the edge of starting this as a service to our patients. The Herzliya Medical Center started with the IVF treatments in the year 1988. Since then, more than 8,000 children conceived in our unit and luckily were born healthy, beautiful, kicking and crying.
Herzliya Medical Center is the leading private hospital of Israel. It's not only private in terms of ownership, it's private in terms of treatment, of personal treatment, and we look at the patients as the center of our work. We treat Israeli people as well as people from abroad. About people from 50 countries are coming to Herzliya Medical Center on a regular basis to be treated, including IVF. The IVF treatment is unique in terms of the sensitivity, and that's why we feel that our environment, including the professionals and technology, will provide the people who seek our care with the best solution for the problem.
My advice to couples considering IVF would be to research their options thoroughly, the success rates of the various hospitals and doctors who are offering IVF, very definitely. The benefits of IVF are success, and if the IVF program is successful, then great joy.
All these methods of assisted reproduction offer couples a good chance of bringing a healthy baby into the world. A consultation and thorough examination are necessary for each individual patient for finding the most appropriate treatment with the highest chance of success. Because female fertility decreases quite quickly after the age of 35, infertile couples should not delay seeking appropriate medical advice.